Coming to the diagnosis of inflammation, whenever we're talking about diagnosis of inflammation, we have acute inflammation and we can have chronic inflammation. And whenever we talk about acute inflammation, what happens is, normally whenever we have an acute inflammation, there's some mediators which will increase and some mediators which will decrease. So in an inflammation, the mediators which increase are called positive acute phase reactants and the mediators which decrease are called negative acute phase reactants. Okay, so positive acute phase reactants are basically the molecules, which are very, very important, which everybody should know. Okay, so these are majority of the molecules are positive acute phase reactants, but negative acute phase reactants are very less. So we should be knowing, okay, negative acute phase reactants predominantly. Okay, so these molecules which everybody should remember it as, remember, RATT. Okay, retinol binding protein, albumin, transthyretin. Okay, so remember, whenever we are talking about this, so remember which is not a positive acute phase reactant. Remember here, transthyretin is a negative acute phase reactant. Okay, and transferrin, of course, both are